Good morning. I am Dr. Brita Lundberg. I am here from Greater Boston Physicians for Social Responsibility to talk to you a little today about the health risks of gas-powered leaf blowers. My story with this subject started in 2017 when I was sitting as a member, and still am a member, on the Mass Medical Society Committee on Environmental and Occupational Health. And our committee was approached by a community in Massachusetts wanting to know more about the health effects of gas-powered leaf blowers and Mass Medical's position on that. We ended up doing a literature review and analysis of the data, and we put out a report that we adopted that year, recognizing the health consequences of gas-powered leaf blowers and informing municipalities who are considering implementing limitations or bans on them. So the two main health effects that we found involved the effects of air pollution and noise pollution. So first, I'll talk briefly about the air pollution issues. The main serious negative health effects of the air pollutants are the well-known pollutants, nitrogen dioxide, carbon monoxide, benzene, and particulate matter. Nitrogen dioxide is associated with both causing and worsening asthma. It's also associated with COPD, with heart attacks. Carbon monoxide is an important one because when your house is surrounded by leaf blowers, those fumes can accumulate inside houses. And carbon monoxide is a known neurotoxicant. It can lead to headaches, fatigue, but it can also be asphyxiant gas when it's in indoor spaces that can be deadly at high levels. Benzene is a known carcinogen, is associated as a cause of childhood leukemia and other blood cancers. And particulate matter, which is commonly known as black carbon, has many negative health associations, which I'll go into in detail here. The kind of particulate matter we're really concerned about is the type called PM 2.5. 2.5 refers to the size of the particle, 2.5 microns. And the important thing to know is that 30, this is a schematic of a shaft of hair on the bottom right there, and 30 particles of particulate matter can fit into the diameter of a shaft of hair. That is how small these particles are. When these air pollutants are inhaled deeply into the lungs, they can aggravate asthma symptoms. They can then cross from those little bronchioles over into the bloodstream, where the inflammation they cause can lead to heart attacks, they can lead to stroke. Patients who are exposed to high levels of particulate matter are more likely to get pneumonia, high blood pressure. Children are especially vulnerable. Interestingly, particulate matter levels are highest at stroller level, and that accounts also for children's particular vulnerability. I should mention that risk exists even at, quote, satisfactory levels. There's no threshold for the negative health effects of particulate matter, benzene, nitrogen dioxide. There's no level that is safe for exposure. So even if you think, oh, I'm just exposed for a minute, that exposure is significant. The other problem with leaf blowers is that they aerosolize toxics that are present in the soil. These can include pesticides, which are known neurotoxicants, as well as heavy metals like lead, which is associated with IQ loss in children, toxics like mercury, but also allergens, molds, and pollens that make allergies much worse. And in certain parts of our state of Massachusetts where radioactive particles are present in the soil, those too will be aerosolized. This is a risk not just to occupational workers, but obviously to the general public, and the elderly and children are going to be at greater risk. I'll talk for a few minutes about noise pollution created by gas-powered leaf blowers. They're loud and they can damage hearing. It's interesting if you use some comparisons. So the sound of traffic is roughly 70 decibels, the sound of an alarm clock, roughly 80. That sounds like the alarm clock is just a little louder than the sound of traffic, but actually for each 10 points in the decibel scale, that's a tenfold increase in level of sound. So by regulation, the noise of leaf blowers is roughly between 70, 75 decibels. That is measured at 50 feet. But those leaf blowers can measure up to 100 decibels at the operators, or if you happen to be passing by a leaf blower, at your ear. So that is over 100 times louder than what is allowed by regulation. The CDC notes that risk of hearing damage is increased above 75 decibels if you have leaf blowers going on all four sides of your house. Obviously, you're not just exposed to 75 decibels, you're exposed to 4 times that noise. And they pose a hearing loss risk to both operators and the general public. OSHA, or the Occupational Safety and Health Administration, does require operators to wear hearing protection, but as you saw in my photo at the beginning of this talk, and I'm sure as you've yourself has observed out on the streets, many operators don't wear this hearing protection because it is cumbersome. And obviously, as the general public passing by, we are not wearing hearing protection. I think it's also incredibly interesting to note the psychological distress that noise pollution can cause. It degrades the quality of life. It doesn't just get in the way of communication, talking, social interaction, but it actually reduces the accuracy of work, especially complex tasks. It creates stress, frustration, aggravation that can last for hours after the noise stops. So in short, the toxics emitted or aerosolized by gas-powered leaf blowers can trigger asthma, COPD. It can lead, things like benzene can lead to malignancies, heart attacks. The noise pollution can lead to hearing loss. The risk is both to the public, especially to vulnerable populations like children and the elderly, and the risk is also to occupational workers because protective gear may not be worn and dust masks may not be sufficiently effective. The good news is that we have tools to transition to a healthier community. Among those are battery-powered leaf blowers. Raking is probably the most energy efficient, lowest fossil fuel expenditure, healthiest option for both the operator and the general public.